Hello again. This is Namir giving some points of view about traditional Thai massage, theory and practice for the benefit of anybody who's interested. If you'd have seen some of my other videos, you might have seen that I introduced certain concepts which until recently have not been that well known, purely because I've been fortunate enough to find and study with a traditional Thai medicine doctor who has been given the authority and the duty to transmit the Thai regional medicine, in other words, not the medicine of centralized government in Bangkok, but that which is practiced mostly in the regions and through the long tradition, to bring it outside Thailand, in part to preserve it and to make sure that it survives. One of the points I'd like to speak about today is about the theoretical aspects of Thai massage. Probably most people who have studied Thai massage have learnt the theory of 10 energy lines, which is promoted by the Thai government and taught in most of the schools. And I'm not going to talk about that, partly because it's not something that I've understood, and I think there's a lot of lack of clarity around it, and I've never been able to apply the theory to practice in a clear way. So I was very happy to learn that there's a very different system of understanding of the human body, which is very clear, related to the 5 body layers and the 4, 5 or 6 elements. Now I'm not going to go through that because I have gone through it in another video, but this is more about the application of the theory, what it means to have studied and to a certain extent digested. I'm no means an expert, but I do use this knowledge to understand the techniques, which if you look beside me, there are some of the techniques which have made Thai massage famous. These are the manipulative techniques, which are one part of the Thai massage. So really it's about trying to harmonize the method, the practice that we do, and to explain it in traditional terms. In other words, what the traditional Thai understanding, at least of based on traditional Thai medicine, in part will be saying why we do these techniques. And here we just have to be quite clear that Thai massage, along with traditional Thai medicine, was outlawed for the best part of half a century or more in Thailand, and it was really only in the 60s that it became revived by the government, and with all that that implies. So a lot of the Thai people who are actually studying and practicing may not have access to this their own ancient traditional knowledge, because it was, as it was, outlawed in favor of Occidental medicine in the great push forward by the king at the time. So even some of this knowledge is new and unusual for Thai practitioners, that might be doing all these techniques, but perhaps, and might be doing them very well, but wonder quite what is the original logic or reasoning or explanation why we are doing such techniques. So, which gives a kind of a point of view. You can look at things from the point of view of traditional anatomy and think about what you're doing and to visualize it in a clear way, without necessarily having to rely on modern, or let's say modern medicine and anatomy terms. So thinking about what is actually going on. So as we've seen before, the body is divided into the layers: skin, first layer, and then tissue, which is subcutaneous fat and muscle and fascia. In the second layer, then the channels, which are, to repeat, blood vessels, usually the main blood vessels, nerves, and obviously very interestingly, tendons and ligaments, which the channel is defined as some kind of way of transmitting. It's a pathway for lom, which is energy or movement. And then from the channels, then it's the bones, is the next deeper layer, and from the bones we get to the organs, the open organs, the ones that have contact with the outside, and the closed organs which don't have contact. And this is also the way in which a disease or a problem works its way through the body, having also worked its way through the various bodies, from the spiritual body to the mental body, to the emotional body, to the energetic body, and then the physical body. So the other part that within this, or the human body, is a natural system, and the natural system is experienced, or experience of nature, which is what is fundamental. Being a Buddhist idea, the Buddhist philosophy is that we are, everything is about what we are actually experiencing and being awake and true to that. And the elements, the four specific elements which deal with physical reality, are in fact, experiences of reality, and they correspond to the solid experience, the experience of solidity and its qualities, the experience of liquidity or wateriness and its qualities, the experience of movement of either of those two, and the experience of change and heat. So in that order is earth, water, wind, and fire. So as we work through or address each of the layers, when we're working, obviously the first point of contact is always the skin. And we see the skin is a mixture in itself of earth, and it's a structural element, but it has this liquidity, there's water in it, and we can assess the balance between the earth and the water in the skin to see how flexible it is, or whether it's puffed up, might have too much water, or very dry, too little water. And then we can think about the relationship between earth and water, both in nature and by having read, but basically it comes directly from nature, to think about how we address, for example, a scarcity of water, or a scarcity or an excess, a swelling of water in the skin. Having dealt with that, and well, one of the ways you might deal with it is to, the appliance of heat to skin will render it more liquid. It's like applying, if you warm up a solid, it tends to get more fluid, and that is actually what's happening in very subtle levels, not just on a gross level, when you sort of warm up the skin first to render it more fluid, more liquidy. So you're working with the liquid element in order that it will because water has a tendency to take the shape of the container and to move when you apply it, to go down to the next layer, which would be tissue. And then you would have to assess the tissue by trying to feel again for the relationship, between the elements, between the earth element, which is the actual fibers, muscle fibers and things, and the fascia, and the liquid element, which is all the blood that is flowing through them, and to see how, again, a tightness of the earth element, a contraction of the earth element, or a blockage of the earth element will block the flow of water through it, and you get stagnation, just like looking at, a river, or in farming, a little irrigation channel gets blocked or it doesn't get cleared because you need to clear things, leaves, everything, there's accumulation, there's a natural order of things. Keep it clear in order to keep the flow going through it, in order that the earth itself absorb the liquid and be in the right balance between the elements. So straight away we're able to visualize what we're doing without any recourse to kind of Western anatomy or to anything esoteric or subtle. What we are visualizing is directly what you can sense under your skin. And then if there's a necessity to deal with that, for example, how do you deal with a lake, that has formed, a ponding that has formed, stagnation of water? Obviously you have to open and try and let it move away, move the water along its natural flow. So you'd be, in that case, think of moving the blood along its natural flow in whichever direction it should have been going when it got blocked. On the other case, if we've come across something like excessive heat or an inflammation, then you would want to, in that case, think about the relationship between fire, which is being created, and it may have been created through a deficiency of water, or perhaps through an excess of wind rubbing things together. The wind is blowing everything around, and obviously then you don't want to apply more wind. So remember, the wind is actually movement, which is pressing, stretching, moving around. You need to move the wind away, and in a certain way to starve the area of things that are continue to make the fire. So fire will not burn in a vacuum. Wind is a great agitator of fire. So this is how we're thinking on the level of tissue, and then after that, if we go deeper, we might have, through our initial analysis of the body, there are certain ways to see how the wind, the biggest winds are the winds, for example, which flow through the great arteries, down the femoral artery, the humeral artery. These are big winds, and the nerves, of course, which transmit. You might see that there are certain blockages in there, and there are techniques. As the winds come to the joints, the winds, as it were, come to the surface. It's sort of big, like a rock inside the knee and inside the elbow, and so it comes very close, and there's a kind of compression of the wind, and that's what they call the wind gate, where we're talking about, the actual trapping of the veins and the nerves between these large earth elements, and you can use those to get access to the flow of fluids, tissue fluids in the body, such as particularly blood, lymph, and nerve, which is what the wind. One aspect of what the wind is. Wind is movement. It's not an esoteric. Even if it's an esoteric thing, esoterically it's a wind. Subtly, it's thinking moves. That is wind. But it is in all senses. Wind is always movement, and so movement of the body happens through wind, whether we're talking about a subtle realm or a gross level. So then we will apply certain techniques to move the wind, the channels, which are in the channels, whether it's through the nerve, or to clear blockages to the wind, because you get kind of congestion, which can sort of block the wind, the growth of, the flora and fauna of the body, the nature of the body can obstruct what is a nice flow of the wind. Remember, of course, the water itself has no capacity in itself to move. It's only when wind blows the water or it flows, there's wind. So the flow of blood is actually the wind element and the water element together. When there's no wind element, the blood pools and stays where it is. And then, so again, a very clear idea of channels and things, which using real substances that we can experience with our hands. Moving on from the channels, or in the case of some other channels, the more subtle ones are the tendons and the ligaments. We can see that quite often they can get stuck, maybe, or scar tissue or something, in the tendons due to usually a kind of lack of water or lack of flow. Immobility creates sort of these kind of adhesions, stickiness, And we reintroduce mobility in order that the flow, the wind of the liquids, and to stimulate this kind of hydration of the tissues. So we're doing very small movements on the tendons here to unblock them, or even on the ligaments, which is rarer and more complicated. So then we come to bones, and so bones are earth element, but there is flow between them, and a lot of problem happens at the joints. Through wear and tear, they get degradation of the earth element. You get worn out through all that rubbing because perhaps not enough water flow and not enough wind. And you might get compression due to tight muscles, so there's also the space element. And so the pulling that we do of the fingers is to open up space in the bones, and the range of movement exercises that you do is to reintroduce the wind into the joints, and also as the wind blows the water, so it hydrates the joints. And then there's a pulling, and there's certain manipulations I do with also, where it might be channels in terms of tendons and ligaments. It could be tissue, it could be bones, all those things, or only one of them. It depends on where we see that the problem is. So already we're getting very deeply into the anatomy of the body, in terms of trying to understand, and then applying each one of these techniques depending on exactly what it is we're trying to do. Some stretches, or most of these manipulations would be working, all the layers, but you can see that the problem is in one layer and use it, and then you might use the same technique to address a problem in another layer. And then finally, after the bones, we come to the organs, which is a more complicated and deeper work, but again, the same things apply. We're talking about movement of fluid in many cases, and adhesions or imbalance of the earth element with respect to water element, stagnation of blood, blocking of the wind which goes inside the intestines, where you get constipation and things. So there we're also working to unblock basically the flow of wind through what we can feel and what we also talk to the client about their problems. So this gives us a very clear schema, a very clear understanding, and the more we study, the more we can be clear and visualize exactly what we're doing. Okay. And this is I'm talking about the gross level, the gross anatomy of Thai medicine. Why it can be useful, why it's a good idea now that this information is out, to avail oneself of it, so that, to enrich one's understanding of what it is actually is doing, and to combine it with whatever else one might have learned about other theoretical aspects of Thai massage, and there are many, including the spiritual ones, the cultivation of the Brahmi Viharas, the 4 states and boundless states, and a certain personal practice which works inside on our subtle energetic state. Right. So I hope that's useful. Thank you very much. Thank you.